are empty. Our figures have Miami as 33%. I talked to the mayor, county mayor. He said that they're at 40% vacancy right now in Miami-Dade. And so part of the reason they're doing all the social distancing and all this stuff with the schools being out and all the other things that have been tough for a lot of people is because you want to make sure to spread this out so that the hospital system doesn't get overwhelmed. So just that's something that we're monitoring on an hourly basis, and we've made a lot of contingency plans. But as of right now, that is what the hospital situation looks like in the state of Florida. So I want to thank everybody who's been involved with this. I'm excited that folks are going to be able to come out here tomorrow and get some tests done. And as soon as we have the ability to get more rapid tests deployed, believe me, we are going to do it, because I understand how frustrating it could be to get a test, it gets sent off to a lab, and it's waiting in line with 20,000 other samples, and it takes time for that to go through. To be able to get a quick result is more efficient for our purposes and better for people's state of mind. And so the final point I'll make is, one of the reasons why we're doing this in Southeast Florida, the testing, safer at home, social distancing, all these things, is because if we can continue to work hard and slow this spread of the virus, every single day you do that, you are giving people throughout our country the ability to innovate and provide solutions for this. The amount of products that have been developed just in the past couple of weeks is really mind-blowing. But you have all levers of society who are on board to try to deal with this, and that may mean the rapid testing, it may mean the antibodies, there's a whole bunch of things that it means, but the more we can do a good job here, the more you're going to have an opportunity to really harness that. And I think this pandemic is going to end because of the technological know-how and ingenuity that we see throughout the American people. And I'm awed about what I've seen already, but I look forward to even more good stuff being brought down the pike so we can keep people safe. I'm going to introduce Jared, then the mayor, then we'll take a couple questions. Jared.
Governor, thank you. I want to thank the employees of Palm Beach County. I want to thank the mayor and the county commission, as well as the county administrator, Bill Johnson, the EM director, all of the health systems involved, and the National Guard. Obviously, when Palm Beach County wasn't selected for federal sites, everybody stepped forward to make this happen in record time. And so I want to thank everyone for their commitment. I also want to thank all of the first responders, all of our healthcare workers, our doctors, our nurses, who are really on the front lines of COVID-19 every single solitary day. And so we continue to look for collection kits under every rock, every crevice in this country. We got 15,000 of them in today. I expect another 5,000 in on Tuesday. So we will continue to feed these sites to increase testing, and we look forward to potentially being able to support additional sites around the state of Florida. We have been focusing on PPE, and I want to thank FEMA and HHS. The governor talks to the president every single solitary day, and I want to thank our congressional delegation for pulling together to really make sure that we get those deliveries from the SNS, from the Strategic National Supply. And I'm happy to report that we've received 500,000 N95 masks, 250,000 face shields, 714,000 gloves, 1.2 million surgical masks, and 200,000 gowns from our SNS push. And so we thank FEMA. And we thank the HHS. We've been sending collection swabs to all the counties, even where we don't have massive drive-throughs, because we understand that there are 67 counties in the state, and that we got to make sure that we're spreading our resources, even though South Florida is obviously the focus. And so we've been sending collection kits to Baker, to Collier, to Charlotte, to Pasco, to Brevard, and we will continue to support those county health systems to do testing in counties that believe they need it. All sorts of different supplies are coming into the warehouse in Orlando. We have purchased 3,000 beds, 150 ICU beds. We have purchased now 3,000.
All right, you've been listening to Governor Ron DeSantis and his team talking about the latest on COVID-19 and their response. He wanted to remind everyone about his executive order, Safer at Home, wanting everyone in Southeast Florida to really stay in their homes if they can, if they're not a non-essential worker, to try and slow the spread of this virus. And he wants that until the middle of April. He also said that he is bolstering the ability for state workers and law enforcement to come back if they had already retired. Now, right now, we have 1,600 cases in Miami-Dade, 1,100 cases in Broward, and 21 cases in Monroe. We're going to continue this on our NBC6 News app and at NBC6.com. We'll have a full update at 4 o'clock, and also you can go to the NBC6 app right now for the very latest on this news conference.
Week, songwriters will play us their best.
We'll collaborate,
turn songs upside down,
make songs better.
Watch a hit song created right in front of you.
At the end of every show, we're picking one of their songs
to be one of ours.
Songland premieres Monday, April 13th on NBC.
Sure.
Market right now is like a Ponzi scheme. I have a boiler room literally set up in our EOC, and all day long we try to find these masks. We're talking to brokers, we're talking to distributors, we're talking to medical salespeople, and our first responders. These masks directly at market price, and you cut out your distributors and you cut out the brokers. The governor is going to continue to do everything we can to make sure that our healthcare professionals and our first responders have the PPE that they need. We will chase down every lead. We will spend whatever it costs. But these manufacturers must help us do the right thing. Lives are on the line. And that's what's happening in the private market when it comes to N95s. And so, I want to, again, thank FEMA and HHS for really stepping up and helping fill those gaps. We've really turned the page on other issues with PPE, dealing with gowns and gloves and face shields and goggles. But on the N95 mask issue, right now there's madness in the market. And so, Governor, thank you for supporting this site and letting the division play a role in it. And again, I want to introduce the mayor.
Thank you, Director Moskowitz, Governor DeSantis. Thank you from the bottom of our heart for your leadership and for being here with us today. I can tell you, ladies and gentlemen, as your local county official and county mayor, how proud we should be of the working relationship between your local governments here in Palm Beach County, Broward, Miami-Dade, and Monroe counties, and the state of Florida and the governor's office and the Department of Emergency Management. You've heard sort of a little inside look into the operational difficulties that COVID-19 pandemic has raised in this nation and in the entire world, quite frankly. And I can tell you how comforted I am in working directly with the governor's office and Director Moskowitz. I can tell you that we've had many a conversation and text message and long calls about how we're going to be able to respond to this because we have to bring the operation inside. And to hear Director Moskowitz talk about trying to find these supplies on the private market, and then when we pulled that trigger, within a couple of days, these soldiers have put together one of the most incredible and efficient sites in the state of Florida. I think this site will become a base of operations because I've been told that you will give us as many of the testing swabs as we need. And we have sat down together to say, what can we bring to the table? What can the state bring to the table? What can our partners and other communities bring to the table so that we look at this as not just a community issue, but a regional issue and a state issue. I will also tell you that the governor signed, I was with the governor this morning in Miami, and he signed an important executive order relating to law enforcement officers. When I talk to you during these press conferences about the civic duty and the patriotic duty that you have to abide by the social distancing guidelines, it's to save lives, and we all understand that. It's to flatten the curve. But I want you to understand that as frustrating as it is for you to be at home, to be safe at home, our first responders have to do that and deal with that and then go out into the public because the emergencies of day-to-day life continue through this pandemic. And the fact that the governor has to sign an order to allow retired officers to come back is indicative of the struggles our first responders are facing and our soldiers are facing and our healthcare workers are facing. So I call on you to maintain that civic duty that you have as a member of this community and as an American to maintain the guidelines and dignity of these proceedings because this pandemic is serious. I was talking with our director of the healthcare district, R.C. Davis, who's behind here. And she told me about two people, healthy young men that went into a hospital here with minor symptoms, a little slight fever, and then by the next day they were intubated. Please do not forget the cost that comes with this. and the cost that comes when we have to quarantine our first responders. That's not fair to them, and it's not fair to our community. So maintain your diligence. And Governor, thank you for the resources. Thank you for the leadership. Thank you for the supplies. We will maintain that commitment to the severity of this situation, and we will come out stronger as a county and as a state. One last thing I'd like to say, General Eifert, sir, thank you to your men and women in uniform. They have been outstanding. This is a world-class facility set up under difficult circumstances. You bring great honor, and these soldiers bring great honor to this great state of Florida. Thank you, sir, for your service. Governor, thank you for joining me here today in this county that we love, sir.
Great. Well, thanks, Mayor, and I really want to give a shout out to the National Guard. They've been in this fight. We activated them, early on, and anytime we've needed something like this, it just happens. I don't have to worry about it. You don't have to, worry about whether it's going to be done right. It is. And so I want to thank General Eifert, thank all his team. They've really been a force multiplier here for the state of Florida. And, we were, I remember doing the baseball spring training dinner about a month and a half ago. We knew coronavirus at the time, but society hadn't really shifted in this direction yet. And we had both of the teams here. I was looking forward to be a neat spring. I know a lot of people were probably wanting to boo the Astros after everything that came out, but it just reminds me of, we have a lot of great things in this country that we've taken for granted. This is a challenge, but I do think it's a challenge that the people are rising to the occasion on, and I think that next year, I think we'll be able to be in places like the ballpark enjoying life again. With that, happy to take some questions. Yes, sir. Oh, sorry. No, April 15th. I'm sorry. Yeah. So we're going to go. It's till April 15th, but we're going to be evaluating every day and seeing kind of what some of the trends look like and how things are. I can tell you, I really believe. I think it's going to take a little time to see it because there was no real testing being done in the United States in like February. CDC basically said if you're coming back from China, then you isolate or do it. But there wasn't a belief amongst the CDC that this was spread out or that this had been circulating in America. I personally think it was in Miami during the Super Bowl looking back, but that's not what people thought. So we're getting information. We don't really have a good baseline, but we're looking to see what's happening with all this. But I do think that there are certain things like how flu has really gone down. It usually is done by sometime in April, but in March, you started to see this going down across the country because I think people are now taking precautions. I mean, I never took precautions against the flu. I would shake hundreds of hands a day. I haven't shaken a hand in a month. I'm constantly washing my hands. You're seeing that. People are making those judgments. And so, yes, we're going to be looking at that. So we're mid-April, see where we're at, and then go from there. And I think the president, by doing the 30th, I think he thinks we may be in a better spot before the 30th, but I think he wanted to rather move in rather than have to move out. For us, we're just going to take it a day at a time, have everyone be in there, do a good job, and then see where we're at. But I do think that because of the actions that we've seen with counties like Palm Beach, other things around the state, I do think that that people have been doing the right thing, which is a good thing. Well, so we're looking at Southeast Florida, and so, you do have stay at home, which is, I think, a testament to it's a very densely populated part of the state. You have a lot of international travel coming into Miami. You got a lot of travel back and forth through New York City, which is the epicenter now. And so I think the virus was going to perform a little differently in that environment than maybe some others throughout Florida. Now, we have done stay at home statewide for those 65 and up. Or people that have significant underlying medical conditions. And if you look at this virus, the overwhelming number of people, or overwhelming number of people end up hospitalized or suffer fatality are in those two groups. And so whether you're in Pensacola, Jacksonville, Orlando, Palm Beach, we're asking to do it. But I also think if you look at how the virus is performing in different communities, it probably would be counterproductive to apply that in certain areas where, you have other strategies in place. And keep in mind, not only do you have the 65 and up and the medical conditions, which is above and beyond what the president has called for in his task force. But we've implemented the task force guidelines statewide, and so I think it's a more tailored approach, and I think ultimately it will lead us to have better outcomes, and I think it allows us to avoid some potentially unintended consequences in other parts of the state. Yes, sir. Trying to hire more people, and it's a very crunch, but going online, you will get better results just because it's going to be easier to deal with it. I think people understand we had a 2.8% unemployment rate. We literally, I had people in the unemployment office working for DEO where the director came to me and he said, look, I don't really have enough work, but they'll leave by attrition. I'd rather not fire people. I'm like, that's fine. But that was a much different world. Now you're not just ramping up for a recession. Because if you look at the unemployment claims nationwide and compare it to the financial crisis, it is way, way, way more significant. And I think it's going to get more significant. So that's just a logistical challenge. So Ken Lawson, I've directed him, get as many people as you can to be able to process this. But I do think online would be better. I think people will have better luck doing it online just because of the manpower issue. I'd imagine you'll see people added. I know he's trying to execute as many contracts as he can with different companies that provide this type of support. But this is a crush that we've never experienced in this country, where you have unemployment go here and then all of a sudden go way up there. And in Florida, we were trickling along. We'd have 200 claims, 500 claims, 900 claims a day. Now we're 15, 20, probably have had 25,000 this week. That's also going to be a challenge on the back end of this. And, I'm mindful of trying to do this in a way that's not going to do unnecessary damage to people's livelihoods. Some of the safer at home here, given the circumstances, it's unfortunate, but that I think the locals and me and CDC, we believe that that's a good path forward. Some other places, we're mindful of how that could affect people, but it's going to continue to be an issue, and I just let people know we are working on it. But it's this is not just 0 to 60. I mean, this is like 0 to 120 trying to do it. Yes. We're going to look at it, and I'm also going to look at how the federal, so I have people in my office, we have people in the legislature looking at this massive bill and how this is going to affect. Actually, you had 3 bills. One was more health care, but you have 3 bills that have passed. And so we're looking at that to see what that does, what our options are, how much money we're getting. So we'll be doing it. I would say, though, I hope that if we do our job here and do a good job in the near term, that may obviate the need for this to just be a protracted situation. I can tell you, if you have those types of unemployment claims 6 months from now, that means society is going to be really in bad shape. And I think that would be a very, very bad thing. And I've talked to the president about it. I know he's mindful of some of the effects. And so that's why I think these 2 weeks are really critical. It doesn't mean it's going to be over, but I do think that this is an important marker for us to take a stand on. But we're going to look at all that. We're going to see what's best for our folks, not just the employees that got laid off, but you have small businesses that went from being successful to basically being out of business without a lifeline. A lot of them can get through 2 weeks. They may even be able to get 4 weeks through, but they're not liquid enough to go through this for 6 or 8 weeks. I know Senator Rubio worked hard on that provision in the big stimulus bill, and we've done bridge loans in Florida as well. But that's small business. The big companies, they're going to furlough people. Once it gets better, they'll hire. But some of those smaller businesses, the family-owned businesses, it's an unbelievable crunch. And I just think it would be a shame if, through no fault of their own, they weren't able to get back into business. I don't think so, because I think they're going to send them all to either Quest or LabCorp. And we're also in discussions, Jared, actually I haven't talked to him today about it, but there's another testing company, lab, that we were looking to send things through. and it's unfortunate that this doesn't turn around quicker, but the United States went from, I don't know how many tests had been done in February, but it was in the thousands probably, to now I think we've hit 1 million tests. And so there's only so many commercial labs. They send it all through, but when you test it, you can run it through the machine. If you run one through the machine, then the machine's taken. So they fill it up, they run it all through, and so the end result is it just takes time. That's one of the reasons we're leaning in so much on the Abbott Labs instant test, because if you can get a point of care test, you put the sample in the machine just like a flu test, then all of a sudden, if you're in a nursing home, the workers are fine. You can check the seniors. Healthcare workers will be able to do it and know what they're doing right away. So there's a lot of promise in being able to do that. And I think I do think we're going to get some. I'm optimistic we're going to get some. I think they're going to be making 50,000 a day for as far as the eye can see. And so you see how having that type of technology at our disposal is going to affect our ability to fight the virus. It's going to allow people to have more opportunities, to do things. I think some of these restrictions would probably be able to be loosened, and I think that's all in all a good thing. Okay. Fact, we just mentioned what they're estimating now, and I don't know that the May estimates are usually. It's hard to do this stuff this far in advance, but as of right now, they're projecting another active hurricane season. We had a very active one last year. Fortunately, we had a near miss with Dorian. It didn't hit us, but I would say in terms of the financial preparedness, I do think because of this federal bill, we should be able to get money for this. And so we're spending money, but I think that we'll be able to get reimbursed for what we're doing with the Guard, all the supplies we're buying. And, we're willing, not only are we paying market, if we can get it sooner for our people, we're even willing to pay more just because of the crunch for the masks and all these other things. And so so financially, I think, we'll be able to weather it from the government perspective. I do worry about, how the social fabric holds up. We'll see how much longer this goes. But I can tell you, it's to go from a normal life to now something much different. There's going to be a time when people get really tired of this, and then going into hurricane season, we'll see. We'll see how the virus sustains itself. But yeah, look, you go from one emergency to the next. It makes it more difficult. But we'll be ready to go for it. These guys in Florida with Jared and his team, and then my office. We've been pretty much, we've been 7 days a week all March, all the way up here. We were dealing with it in February, but we've been at a level 1 for most of the month now, and people are turning. It's every day, and people just aren't getting any rest or anything. But that's what you sign up for. But it's a lot, and so hopefully we don't have a hurricane, because I think that I think the people of Florida have been through a lot, and I think it would be great to just say, you know what, we could maybe have a more eventful summer. Thanks, everybody.
Give Dr. Alonso a raise if you don't mind.
Okay.
Great. Yeah.
Oh, yeah. Yep.
Hey guys, come on. Come on. Hey, all out. Come on.